Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Actions of atropine. So atropine acts on different organs. First, it acts on brain. In the brain, it causes hallucinations, amnesia. It is important in anti-motion sickness, especially the drug like hyoscine is responsible. Hyoscine can be used in the treatment of motion sickness. We can use hyoscine or scopolamine. Atropine is the oldest anti-rigidity drug, but has an anti-rigidity drug. It is the oldest anti-rigidity drug, but the most potent anti-rigidity drug is actually trihexyphenidyl is the most potent anti-rigidity drug. Then atropine causes transient bradycardia. Overdose of atropine will cause stimulation of respiration first, followed by depression of respiration is seen. Atropine causes amnesia with excitement, whereas hyoscine will cause amnesia with sedation. Because hyoscine causes amnesia with sedation, this hyoscine is used in narcoanalysis or truth serum. We can use hyoscine, and hyoscine is actually the drug of choice for motion sickness. Okay, and one more thing, hyoscine is also used, has, because of its amnestic properties, it is used in the post World War II to produce the amnesia. In order to produce amnesia, we have used after World War II. In post World War II, this hyoscine is used to produce amnesia.
thank you and thank you for watching.